Probably every week we will run into patients at Franklin Orthopaedics that are complaining of hip pain. And when people say my hip hurts, we have to really dig into precisely what are they talking about, because hip pain to an orthopedic surgeon can be groin discomfort, which means hip joint pain to an orthopedic surgeon. However, the most common complaint of hip pain is actually lateral hip pain. There's a really thick ligament called the iliotibial band that extends up the lateral side of the thigh. It crosses the outer aspect of the hip joint and inserts into the pelvis. And that band can rub up against the top of the femur. Now, anywhere that we have an area of friction, as I'm discussing right now, we have a thing called a bursa. A bursa is a little sac that helps reduce the friction, in this case, between this really thick tendon, the iliotibial band, and the bone of the hip. Bursitis then is inflammation and irritation of that bursa. And so patients commonly present to us with lateral hip pain. It's worse with activity. It really bothers people at night when they try to lie on that side. And so a common complaint of lateral hip pain is consistent with trochanteric bursitis. Treatment of trochanteric bursitis includes stretching. At home, I recommend that you stretch, and I can demonstrate that in more detail in a different video, but you'll know when you're doing it right because you'll feel it pulling across the lateral aspect of your hip. It's always a good idea to start with anti-inflammatories if there's no medical contraindication to you taking them. Aleve or Advil would be a great place to start. What we find is that many patients respond to one particular anti-inflammatory better than perhaps 10 others. And if you cannot find the anti-inflammatory that helps you, come into Franklin Orthopaedics and we'll explore the prescription option for you as well. Another treatment option that really helps a lot of people with trochanteric bursitis is a cortisone injection. As scary as that may sound to you, it's really not a big deal. It's over in just a few seconds. We mix a little numbing medicine in with the cortisone, and before you can even leave the office, you're usually feeling better. So it's really not something to be afraid of. We also have physical therapy available, and would be happy to introduce you to that as well if you need that treatment for trochanteric bursitis. Occasionally we'll see tough cases of trochanteric bursitis. We've had some luck with a relatively new treatment modality called platelet-rich plasma. We can go into that as well in another video, but platelet-rich plasma has been a great new treatment option. At least on paper, there also is the option of surgical treatment of trochanteric bursitis to go in and remove the bursa. I know how to do that. I've been practicing for 30 years, and I can't tell you the last time that I needed to go in and remove that bursa, as an illustration of our success with treating trochanteric bursitis conservatively. When patients have an orthopedic condition, of course they're interested in things they can do at home to try to help remedy that. Anti-inflammatories are helpful, and of course commonly you have Aleve or Advil over the counter. Patients frequently ask us about heat versus ice. Most definitely, if you've just had an injury, you're going to want to use ice for the first 48 to 72 hours. The thinking is heat would perhaps increase the swelling in that area, and that's why we don't recommend heat for the first 48 to 72 hours. After that, or if you haven't had an injury but you just have a painful condition, many patients do feel relief if they will use heat. Be careful with overheating. We've seen that occasional burn from a heating pad being left on too long, so you do have to watch for that. But it is reasonable in more chronic conditions to try a heating pad, and some patients actually get relief with doing both. They will use the heating pad at first and then chase that with an ice pack for a few minutes, and sometimes that modality will be helpful to you.